1. Which of the following medications is most commonly associated with nephrotoxicity? A. Acetaminophen. B. Aminoglycosides. C. Beta blockers. D. Warfarin. Answer: B. Aminoglycosides. Rationale: aminoglycosides, e.g., gentamicin, are nephrotoxic, requiring renal function monitoring. Acetaminophen is hepatotoxic. Beta blockers affect cardiac function, and warfarin is an anticoagulant with bleeding risks. 2. Which of the following is a serious side effect of ACE inhibitors? A. Hyperkalemia. B. Hypoglycemia. C. Bradycardia. D. Hypokalemia. Answer: A. Hyperkalemia. Rationale: ACE inhibitors, e.g., lisinopril, reduce aldosterone secretion, leading to potassium retention and hyperkalemia. They do not cause hypoglycemia, bradycardia, or hypokalemia. 3. What is the most dangerous adverse effect of opioid analgesics? A. Nausea. B. Sedation. C. Respiratory depression. D. Constipation. Answer: C. Respiratory depression. Rationale: opioids, e.g., morphine, suppress the respiratory center in the brainstem. Nausea and constipation are common but not life-threatening. 4. A patient taking warfarin should avoid excessive consumption of which of the following? A. Bananas. B. Leafy green vegetables. C. Dairy products. D. Coffee. Answer: B. Leafy green vegetables. Rationale: leafy greens, e.g., spinach, kale, are high in vitamin K, which can antagonize the effects of warfarin, reducing its anticoagulant efficacy. 5. Which of the following medications can cause a dry cough as a side effect? A. Beta blockers. B. ACE inhibitors. C. Calcium channel blockers. D. Diuretics. Answer: B. ACE inhibitors. Rationale: ACE inhibitors, e.g., enalapril, increase bradykinin levels, leading to a persistent dry cough. Beta blockers may cause bronchospasm, but not a dry cough. 6. A patient taking digoxin should be monitored for which electrolyte imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypercalcemia. Answer: B. Hypokalemia. Rationale: hypokalemia increases the risk of digoxin toxicity. Patients on loop diuretics and digoxin require potassium level monitoring. 7. Which antibiotic is most commonly associated with tendon rupture? A. Penicillins. B. Cephalosporins. C. Fluoroquinolones. D. Macrolides. Answer: C. Fluoroquinolones. Rationale: fluoroquinolones, e.g., ciprofloxacin, are linked to Achilles tendon rupture, particularly in elderly patients and those on corticosteroids. 8. A nurse should monitor for which adverse effect in a patient taking furosemide? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypertension. Answer: B. Hypokalemia. Rationale: furosemide, a loop diuretic, causes potassium loss, leading to hypokalemia, which can result in arrhythmias and muscle weakness. 9. Which medication is most likely to cause lactic acidosis as a rare but serious side effect? A. Metformin. B. Insulin. C. Glipizide. D. Sitagliptin. Answer: A. Metformin. Rationale: metformin can lead to lactic acidosis, especially in patients with renal impairment. Insulin and sulfonylureas do not cause lactic acidosis. 10. Which of the following drugs requires routine thyroid function monitoring? A. Levothyroxine. B. Metformin. C. Losartan. D. Clopidogrel. Answer: A. Levothyroxine. Rationale: levothyroxine, used for hypothyroidism, requires thyroid function tests to avoid under- or over-replacement therapy. 11. Which of the following medications increases the risk of serotonin syndrome when combined with SSRIs? A. Warfarin. B. Tramadol. C. Metoprolol. D. Furosemide. Answer: A. Levothyroxine. Rationale: levothyroxine, used for hypothyroidism, requires thyroid function tests to avoid under or over replacement therapy. 12. Which antihypertensive medication can cause ankle swelling as a common side effect? A. Lisinopril. B. Amlodipine. C. Metoprolol. D. Losartan. Answer: B. Amlodipine. Rationale: calcium channel blockers, e.g. amlodipine, cause peripheral edema due to vasodilation. ACE inhibitors, beta blockers, and ARBs do not typically cause this. 13. Which medication requires INR monitoring to assess its therapeutic effect? A. Heparin. B. Warfarin. C. Enoxaparin. D. Aspirin. Answer: B. Warfarin. Rationale: warfarin requires INR monitoring to ensure appropriate anticoagulation. Heparin is monitored via APTT, while enoxaparin and aspirin do not require INR monitoring. 14. Which of the following medications can cause gingival hyperplasia? A. Phenytoin. B. Furosemide. C. Atenolol. D. Lorazepam. Answer: A. Phenytoin. Rationale: phenytoin, an anticonvulsant, can cause gingival overgrowth. The other drugs do not have this side effect. 15. A nurse should monitor which electrolyte in a patient taking spironolactone? A. Sodium. B. Potassium. C. Calcium. D. Magnesium. Answer: B. Potassium. Rationale: spironolactone is a potassium-sparing diuretic and can cause hyperkalemia. 16. A patient taking isoniazid for tuberculosis should be monitored for which side effect? A. Hepatotoxicity. B. Nephrotoxicity. C. Hypoglycemia. D. Hypercalcemia. Answer: A. Hepatotoxicity. Rationale: isoniazid is hepatotoxic and requires liver function monitoring. It does not cause nephrotoxicity or affect glucose or calcium levels. 17. Which medication is contraindicated in pregnancy due to the risk of fetal malformations? A. Lisinopril. B. Metformin. C. Acetaminophen. D. Loratadine. Answer: A. Lisinopril. Rationale: ACE inhibitors, e.g. lisinopril, are teratogenic and contraindicated in pregnancy. 18. Which drug can cause ototoxicity as a serious adverse effect? A. Furosemide. B. Atorvastatin. C. Losartan. D. Sertraline. Answer: A. Furosemide. Rationale: high doses of furosemide can cause ototoxicity. Statins, ARBs, and SSRIs do not cause hearing damage. 19. A patient taking lithium should be monitored for which toxicity symptom? A. Polyuria and tremors. B. Bradycardia. C. Hyperglycemia. D. Hypotension. Answer: A. Polyuria and tremors. Rationale: lithium toxicity manifests as polyuria, tremors, confusion, and seizures. 20. Which of the following medications can cause a harmless but alarming red-orange discoloration of bodily fluids? A. Rifampin. B. Ciprofloxacin. C. Metronidazole. D. Acyclovir. Answer: A. Rifampin. Rationale: rifampin causes red-orange urine, sweat, and tears. The other medications do not have this effect. 21. Which of the following drugs can cause QT prolongation and increase the risk of torsades de pointes? A. Azithromycin. B. Metformin. C. Lisinopril. D. Warfarin. Answer: A. Azithromycin. Rationale: macrolides like azithromycin can prolong the QT interval, leading to arrhythmias. 22. Which anticoagulant is commonly used in pregnancy due to its safety profile? A. Warfarin. B. Heparin. C. Rivaroxaban. D. Aspirin. Answer: B. Heparin. Rationale: heparin does not cross the placenta, making it safer than warfarin during pregnancy. 23. Which medication is most associated with the risk of rhabdomyolysis? A. Atorvastatin. B. Losartan. C. Metformin. D. Digoxin. Answer: A. Atorvastatin. Rationale: statins can cause muscle breakdown, leading to rhabdomyolysis. 24. Which of the following drugs can cause life-threatening angioedema? A. Lisinopril. B. Metoprolol. C. Omeprazole. D. Sertraline. Answer: A. Lisinopril. Rationale: ACE inhibitors can cause angioedema, which can be life-threatening. 25. What is a potential adverse effect of long-term use of proton pump inhibitors, PPIs? A. Osteoporosis. B. Hypoglycemia. C. Hyperkalemia. D. Hyperthyroidism. Answer: A. Osteoporosis. Rationale: PPIs reduce calcium absorption, increasing the risk of osteoporosis and fractures. 26. Which of the following medications requires regular thyroid function monitoring? A. Levothyroxine. B. Amlodipine. C. Metformin. D. Spironolactone. Answer: A. Levothyroxine. Rationale: levothyroxine requires TSH monitoring to ensure appropriate thyroid hormone levels. 27. A nurse should monitor for which adverse effect in a patient taking amiodarone long-term? A. Pulmonary fibrosis. B. Nephrotoxicity. C. Thrombocytopenia. D. Hypoglycemia. Answer: A. Pulmonary fibrosis. Rationale: amiodarone can cause pulmonary toxicity, leading to fibrosis. The other options are not typical side effects. 28. What is a significant adverse effect of vancomycin when administered too rapidly? A. Red man syndrome. B. Stevens-Johnson syndrome. C. Hepatotoxicity. D. Hypertension. Answer: A. Red man syndrome. Rationale: rapid vancomycin infusion can cause histamine release, leading to flushing and hypotension. 29. A patient on clozapine therapy should have regular monitoring for which adverse effect? A. Agranulocytosis. B. Hypertension. C. Hepatotoxicity. D. Hyperglycemia. Answer: A. Agranulocytosis. Rationale: clozapine can cause severe neutropenia, agranulocytosis, requiring frequent WBC monitoring. 30. Which of the following medications increases the risk of lactic acidosis in patients with kidney dysfunction? A. Metformin.
B. Insulin.
C. Glipizide. D. Sitagliptin. Answer: A. Metformin. Rationale: metformin can accumulate in kidney dysfunction, leading to lactic acidosis. 31. Which of the following drugs should be taken on an empty stomach for optimal absorption? A. Levothyroxine. B. Ranitidine. C. Atorvastatin. D. Metoprolol. Answer: A. Levothyroxine. Rationale: levothyroxine is best absorbed on an empty stomach. 32. Which antihypertensive is contraindicated in patients with asthma? A. Metoprolol. B. Lisinopril. C. Amlodipine. D. Hydralazine. Answer: A. Metoprolol. Rationale: non-selective beta blockers can cause bronchospasm in asthmatic patients. 33. What is the primary adverse effect of opioid overdose? A. Respiratory depression. B. Tachycardia. C. Hypertension. D. Diarrhea. Answer: A. Respiratory depression. Rationale: opioid overdose suppresses the respiratory center, leading to hypoventilation and possible death. 34. Which medication should be avoided in children due to the risk of Reye's syndrome? A. Aspirin. B. Acetaminophen. C. Ibuprofen. D. Naproxen. Answer: A. Aspirin. Rationale: aspirin use in viral illnesses can cause Reye's syndrome, a life-threatening condition. 35. A patient taking digoxin should be closely monitored for which electrolyte imbalance? A. Hypokalemia. B. Hypercalcemia. C. Hypermagnesemia. D. Hyponatremia. Answer: A. Hypokalemia. Rationale: low potassium increases the risk of digoxin toxicity, leading to arrhythmias. 36. Which antibiotic class can cause tendon rupture? A. Fluoroquinolones. B. Penicillins. C. Cephalosporins. D. Macrolides. Answer: A. Fluoroquinolones. Rationale: fluoroquinolones, e.g., ciprofloxacin, can weaken tendons, increasing the risk of rupture. 37. Which medication should be given with food to reduce GI irritation? A. Ibuprofen. B. Levothyroxine. C. Alendronate. D. Omeprazole. Answer: A. Ibuprofen. Rationale: NSAIDs like ibuprofen can cause stomach irritation and should be taken with food. 38. Which medication can cause the adverse effect of priapism, prolonged erection? A. Trazodone. B. Metoprolol. C. Furosemide.
D. Omeprazole.
Answer: A. Trazodone. Rationale: trazodone, an antidepressant, can cause priapism due to its alpha-blocking effects. 39. Which drug is used to reverse opioid overdose? A. Naloxone. B. Flumazenil. C. Protamine sulfate. D. Atropine. Answer: A. Naloxone. Rationale: naloxone is an opioid antagonist that rapidly reverses respiratory depression. 40. Which class of antihypertensives is associated with a persistent dry cough? A. ACE inhibitors. B. Beta blockers. C. Calcium channel blockers. D. Diuretics. Answer: A. ACE inhibitors. Rationale: ACE inhibitors increase bradykinin levels, causing a dry cough. 41. Which drug should be avoided in patients with peptic ulcer disease? A. Aspirin. B. Acetaminophen. C. Omeprazole. D. Ranitidine. Answer: A. Aspirin. Rationale: aspirin can exacerbate ulcers by increasing gastric acid secretion and irritation. 42. Which drug is commonly used to prevent nausea and vomiting in chemotherapy patients? A. Ondansetron. B. Metoprolol. C. Atorvastatin. D. Warfarin. Answer: A. Ondansetron. Rationale: ondansetron blocks serotonin receptors, reducing nausea and vomiting. 43. Which medication is an antidote for benzodiazepine overdose? A. Flumazenil. B. Naloxone. C. Atropine. D. Protamine sulfate. Answer: A. Flumazenil. Rationale: flumazenil is a benzodiazepine antagonist that reverses sedation and respiratory depression. 44. Which antidiabetic drug is contraindicated in patients with heart failure? A. Pioglitazone. B. Metformin. C. Sitagliptin. D. Insulin. Answer: A. Pioglitazone. Rationale: pioglitazone can cause fluid retention, worsening heart failure. 45. Which drug is used to treat acetaminophen overdose? A. Acetylcysteine. B. Naloxone. C. Protamine sulfate. D. Vitamin K. Answer: A. Acetylcysteine. Rationale: acetylcysteine replenishes glutathione, preventing liver damage from acetaminophen toxicity. 46. Which diuretic is potassium-sparing? A. Furosemide. B. Spironolactone. C. Hydrochlorothiazide. D. Mannitol. Answer: B. Spironolactone. Rationale: spironolactone is an aldosterone antagonist that retains potassium. 47. A patient taking lithium should have which lab value monitored regularly? A. Sodium. B. Glucose. C. Calcium. D. Magnesium. Answer: A. Sodium. Rationale: low sodium increases lithium toxicity risk. 48. Which of the following is a major side effect of statins? A. Myopathy. B. Hypotension. C. Hyperkalemia. D. Bradycardia. Answer: A. Myopathy. Rationale: statins can cause muscle pain and rhabdomyolysis. 49. What is a serious adverse effect of methotrexate? A. Bone marrow suppression. B. Weight gain. C. Hypertension. D. Tachycardia. Answer: A. Bone marrow suppression. Rationale: methotrexate suppresses bone marrow, increasing infection risk. 50. Which drug is most commonly associated with gingival hyperplasia? A. Phenytoin. B. Warfarin. C. Metformin. D. Atorvastatin. Answer: A. Phenytoin. Rationale: phenytoin can cause gum overgrowth.